Following the National Senior Citizen Centre's two strategic pathways, older persons are being integrated into existing programs, activities and budget lines in partnering MDAs and are primary targets in NSCC's carefully designed new opportunities and flagship programs to address specific socio-economic challenges and protect older persons from poverty and social vulnerabilities. By increasing the income and livelihood of the poor and vulnerable older persons, increasing access to appropriate health services, age-friendly physical and social environment, as well as addressing neglect, discriminating and violence against older persons by providing public information, education and rapid remedy mechanisms and access to justice and toll-free call lines. In line with the National Senior Citizen Centre Act 2017 and the National Policy on Aging 2021, NSCC is now progressively laying concrete three-tier stakeholder structures to enable the cascading of its strategy, programs, partnerships, and engagements into states and local government areas using its effective, sustainable, inclusive, and participatory states stakeholders consultative forum in 36 states and the Federal Capital Territory, while building partnerships with relevant state ministries, departments and agencies through high-level advocacy and bilateral and multi-sector technical work engagements. The general goal of the stakeholder engagement mechanism is to deliver as one on mandate to improve the quality of life of older persons in Nigeria without leaving anyone behind, regardless of status or location, especially to reach the poor and vulnerable. The stakeholder group is composed of 8 categories: National Union of Pensioners, Association of Older People, professionals in aging and related subject matters, research academia in field of aging and related areas, representatives of traditional institutions and elders council, representatives from major faith-based organizations, civil society and community-based organizations registered in the field of aging, gender, women, disability, health, social welfare, agriculture, and entrepreneurship. The inclusive multi-sectoral composition of National Senior Citizen Centre Stakeholders Consultative Forum across the 8 categories, reflecting the multi-dimensions of issues of aging and NSCC's determination that no one will be left behind, has a governance structure that promotes inclusion, active participation, ownership, and interstate and multi-sectoral learning and operations. The state stakeholder group in each state is administered by a competent steering group composed of 2 co-chairs and 6 vice-chairs who serve as focal persons for the 6 NSCC thematic priority areas, namely health, social care and insurance, livelihoods, pensions matters and social assistance, agriculture and food security, continuing engagements and learning opportunities, age-friendly environment and services, transport, housing, water and sanitation, research, data and documentation. All other members of the stakeholder forum are aligned by their thematic areas of interest. The 8-member steering group of each of the 36 states of the Federation and FCT constitute NSCC's National Stakeholders Consultative Forum. So far, 30 states forums are in place with solid inclusive governance structure. NSCC, leveraging digital technology, is seamlessly engaging with stakeholders so far across states and building partnerships with states and local governments to domesticate the National Senior Citizen Centre Act and to evolve the state policies on aging where there is none yet in place. NSCC is working tirelessly and facilitating stakeholders' capacity enhancement programs to enable understanding of aging as development issue, not welfare, to know NSCC's programs and their states in effective partnerships to progressively deliver dividends in the prioritized thematic areas. National Senior Citizen Center thematic dialogue platforms daily facilitates stakeholders' input and active participation in generating innovative ideas and subcultural considerations for reaching and delivering programs for older persons in the grassroots and advocating to government for NSCC's programs to be aligned with their state's programs and services. The National Consultative Forum is both an NSCC engagement mechanism and a multi-purpose vehicle to deliver acceptable programs even to hard-to-reach places. Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, Hajiya Sadiya Umar Farouk, Chairman and members of NSCC Governing Board, strategic partners, ladies and gentlemen, in no particular order, we most respectfully invite for formal inauguration of the National Senior Citizen Center National Stakeholders Consultative Forum, the co-chairs from the first 26 states to evolve the NSC's prescribed inclusive governance structure here present, beginning with Abia State, Mazi Oti Nwaka, Sarah Anaba Nwajobi, JP, Adamawa State, Engineer Tumba Vandi Yana, Abbas Yunusa Buba, Akwa Ibom State, Obong Obong Esien, Dr. Udwak Eshet, Anambra State, Iyom Josephine Aneni, Dr. Ahoma Victor Mbano Zuru, Benue State, Lady Teresa Atsa Siene, Ukan Kuro, Cross River State, Reverend Mrs. Mercy Akpama, Alhaji Sani Baba Gombe, Delta State, Ambassador Mrs. Caroline Isikpedo Oliseowe, Mr. Uti Geoffrey Chukwuweken, Ebonyi State, Dr. Chihurumanya Alo, Dr. Mark Abani, Ekiti State, Ariyibi Ebenezer Kayode, Olatilu Omotayo, Federal Capital Territory, Dr. Ugogwa Osiogbu, Comrade Ehada Mohammed, Gombe State, Dr. Umar Mohammed, El Harun Lamido Umar, Kaduna State, Hawa Asabe Yahaya, Adamu Siraju Jibrin, Katsina State, Mukhtar Gambo Lawal, Ambassador Suleiman Bello, PhD, Kebbi State, Usman Abubakar, Issa Bello, Kogi State, Nuhu Musa Muhammad, Elder Stephen Salahu, Lagos State, Ambassador Ayodele Idowu, Oluwa Damilola Grillo, Niger State, Alhaji Hassan Wasagi, retired, Mrs. Ruth Kai, Ogun State, Honorable Oludare Olushaga, Professor Eunice Modupe Hassan, Ondo State, Samuel Adegboyega Ayeni, Mrs. Rachel Olufunwa Agbi, Plateau State, Aston Bitrus Dangata Chatau, Sani Muazu, Kano State, Ambassador Habib Baba Habo, Hajiya Rabi Yusuf, Oyo State, Olushola Adetoro Olagunju, Chief Kikemo Laniyonu Edwards, Rivers State, Professor Hope Ilanye Belgam, Professor Aaron Ojule Chinoye Ojule, Imo State, Philomena Anyanwu, Dr. Udo Inyang David, Yobe State, Bala Tanko, Dr. Shuaibu Ghana, and from Zamfara State we have Lawal Issa Bungudu, Halima Muhammad.